It's so important as we address mental health to really help people meet their goals and to be the best version of their self.
Absolutely. We are joined by Gina Tumasi, who's telling us the benefits of seeing a psychiatrist. I not only have one, I have two psychiatrists. Tell the difference between a psychologist and a psychiatrist. Can you just enlighten us a little bit about that?
Yes. So yeah, it's so amazing to be here today. But yeah, a psychiatrist is able to do therapy or counseling as well as medication prescribing. By psychologists only does therapy.
Okay.
A lot of times you might work as a team, but you know, so many times this is an obstacle for people. Either they feel like they're not covered, or it's going to be expensive, or they don't have the time to go, and especially in communities of color. And you are really taking away some barriers because you have a new service called Psych on Demand. And does that mean people can get the same services, but they just call you, or is it a Zoom, or however they do it?
Yeah. So they can just call me, and I can, you know, the number I can leave at the end of it. But yeah, just like the name suggests, you don't have to wait weeks and weeks before you get your appointment. Appointments are usually within a week or two to see a therapist or myself to prescribe, and I have another provider who prescribes. So that wait is cut off, and we can do it by phone or by video. So people can reach me from their bedrooms, from their cars, on their lunch break. I have patients who interact with me while they're having lunch, and it's pretty quick, and they still get services, especially with the anxiety and the stress and the trauma that we went through from the pandemic. This has been so amazing. And one of the other reasons why it changes is because we've seen an uptake in kids, preteens, teens, young adults especially, really struggling with a lot of anxiety and trauma, behavior issues. So I opened it up a little more to start taking patients as young as 4 for myself. My other provider also come back. I've been seeing more and more that age group, elementary school kids all the way through middle and high school and college. So that's one of the reasons why I changed it to on demand, so people will know you're getting services pretty quickly when you reach out.
You say unresolved emotional conflicts lie at the core of human suffering. Talk to us a little bit about that.
Yeah, so I found through research, especially being that myself, I'm an immigrant, right? This type of things I know exposed to us back home, but through research and education over the years, emotional suffering, I have found, as well as other colleagues through the research that we're doing, found that emotional suffering has been one of the core of struggle for all of us as humans, as we do, you know, being kids, and as we do this thing called adulting. Is really difficult emotionally if it's not managed or you don't seek help for it.
Right, and especially there's something called ACEs, adverse childhood experiences. So there could be something, you could be an adult and not knowing why you're all of a sudden hitting a bout of depression or anxiety that could have been triggered by the pandemic, but it's really like some unresolved issues within that's happened maybe when you were 8 or 9, and you might need an expert like yourself to help unravel it. The good news is there are treatments that you can effectively heal from past traumas.
Yes, absolutely. So this is such a passion of a topic for me. In our communities of color, and also immigrant communities, we have this thing, the adage that we say, what goes on behind closed doors stays behind closed doors, or spare the rod and spoil the child. But for, you know, from research, yes, you can reprimand the child, you can, you know, correct the child, but the approach, the love or the care, the empathy that you go about doing that is really, really crucial. Now, when there are environments where there's a really toxic stress, we call it toxic stress, over a long period of time, and there's no help. We have parents who might have struggles with substance abuse, who might have their own mental health struggles. But once again, being a community of colors, especially immigrant communities, there's such shame with looking for help or even acknowledging that there's a problem. If there are parents who are going through divorce or separation, which is fine, it happens, life happens, but it's the contention of it when the kids are exposed to that for a long time. Also, not to talk about parents who might be going, you know, to jail in and out or going to rehab. Things like that really causes many of the children to start having behavior issues. And now the pandemic, everybody was kind of on top of each other. That's kind of now, you know, the gate is open. These kids are back to school and we're seeing this behavior changes, which, you know, if I have a minute, I can talk about some of the subtle signs that sometimes can be missed.
We have about a minute left.
So 1 minute. I want to talk about like behavior changes from baseline, like when the other kids don't show that same pattern of behaviors. Or in girls, there could be like OCD-like tendencies. There could be like even showing up like eating disorder in some of the kids, the girls. Outbursts, aggression, anger. And sometimes it's like, oh, this is a bad kid. It's not a bad kid. It's just what happened or what is happening to the kids. So really, primary care providers, somebody like me, teachers, please, we need to wake up as well as parents to see the child. Is there something going on? If you see something, say something rather than covering up saying this is a bad child. It's not a bad child. It's what might be happening to the child.
The good thing to remember, right? They're not giving you a hard time. They're having a hard time.
Exactly.
So,
All right.
So we can get some help.
Yeah, to book an appointment, just visit Gina Tumasi Health, Gina Tumasi mentalhealth.com.
Right.
We so appreciate that.
Yeah.
And you have a phone number you'd like to give
call
us?
860-288-2177, and there's 2 people on the phone all day that will answer you promptly.
Terrific.
Yes.
Thank you so much for being with us.
All right, so excited.
So good to see you.
Thank you.